This is Face the State for Sunday, December 21st. Oh yes, we are this close to Christmas, so we're making a list, we're checking it twice. Which politicians are naughty or nice? Is it a naughty thing to change the name of the Kennedy Center? Or maybe it's a nice tribute from the center's board. We'll discuss. It would be nice to find missing people faster, so we're talking to a lawmaker who thinks purple alerts are the way to do it. And would it be naughty to use AI in the medical field without telling the patient? A new bill is trying to address that sooner than later. It is time for a very nice version of Face the State.
CBS 21 News presents Face the State with Joel D. Smith, a look at the issues and politics that shape Pennsylvania.
And once again, thanks for being here on what's almost a holiday weekend, right? And we are joined by the state representative with multiple bills designed to protect children. Let's talk to Columbia County Republican Robert Ledbetter. Good to see you, sir. I would say you look festive, but you have layers of festive going on right here. So nice to see you.
Joel, appreciate you having me. Merry Christmas to you and everyone out there.
Yep, for sure. We're celebrating a lot. And what you'd like to celebrate is getting this bill through. It's called Aiden's Law, named after Aiden Ha, the boy who had autism. He was on the spectrum. He went missing in Columbia County. His body was eventually found in the river. So take us back a little bit to this time and what you were thinking then before we get to maybe some ways to get a better outcome next time.
Sure. No, Joel, I appreciate bringing attention to this. Aiden was a constituent of mine, a young man, and as a father to an 8-year-old girl and a 6-year-old girl, every parent, grandparent, family member that's exposed or around young children can appreciate and understand the absolute horror that the Ha family went through in those first hours of searching. Aiden was a nonverbal autistic child, and when he went missing, we were limited to the municipal police department's Facebook page to push updates out. And while I commend and applaud the efforts of law enforcement and our community that poured out in searching, I was honored to participate in the outpouring of folks that came to volunteer and mobilize in the search for Aiden. The tragedy was made known to us the following morning when tragically his body was found in the Susquehanna River. This is when constituents overwhelmingly came to my office and expressed to me that Pennsylvania does not have a purple alert system. Other states do, Joel, and similar to a silver alert system for seniors or an amber alert system for missing persons, a purple alert system would allow us to push out information immediately in a notification manner to police, neighboring communities, transportation hubs, so that way we could assist and react quickly, because as we saw with this tragedy, every minute matters.
I know we also want to be sensitive to not sending out too many alerts where people would sort of become, immune to it, right? And they get too used to it. So these have to be very specific situations, I know. What is the situation that you're talking about that would trigger a purple alert?
Sure. Again, these nonverbal individuals with cognitive disabilities, when they go missing, Joel, it's imperative that we as a community are able to respond in an active manner. And so it wouldn't be a spam message that folks may be concerned about. Again, this would be targeted to the police. It would be targeted to the organizations that are specialized in working with these individuals and the transportation hubs and locations and geographies that may fall into consideration for that missing person.
So take me through the best case scenario then. How fast would this trigger? Who would actually get the alert? How would we know?
Sure. So it'd be immediate, Joel. And again, I'm not suggesting that it's a magic wand. If Pennsylvania had a purple alert, it's very unfortunate that we may have ended up with a similar outcome. However, I'm a big believer in incrementality as a private sector guy. There's no such thing as the status quo. And if we can get law enforcement more tools, I'm always going to be an advocate to support in getting law enforcement those incremental resources so that way they can better serve our communities. This, again, would be a scenario where the purple alert would go out, and just like an amber alert will activate or a silver alert will activate for seniors or older adults, the purple alert would be targeted for those individuals with cognitive disability, and then we would not be limited to the bottleneck of, for example, a municipal Facebook page or the updating of an individual where miscommunication can occur.
Would this be on signs? Just quick answer here. On signs or actually on the phone as well, where like an Amber Alert hits, you hear this big sound and everybody in the newsroom or your office all gets it at once?
Yeah, so the way that the legislation is written is it's open to both. And of course, working with the legislature, we were happy to collaborate in a way that makes the most sense for Pennsylvania.
How often do folks like this that would fall in this category go missing in PA, maybe every year?
It's more often than not. I won't cite a specific statistic, Joel, because again, going back to the absence of a system, the data is not always finite.
Yeah.
But across the Commonwealth, this is happening, and it is not rare.
Gotcha. Okay. You're also co-sponsoring another bill we want to talk about. This passed in the week, this week already in the State House. It was unanimous. It would require additional people to get trained to watch out for human trafficking, to understand it. Hotel, motel employees, we know that's a place that sometimes this would happen. So tell us a little more about that.
Again, Joel, this was a great effort in a bipartisan capacity, working with Representative Nelson, Representative Khan, Representative Young. House Bill 1286 is an awareness bill that helps us battle back against human trafficking and empowering and equipping employees within the hotel and restaurant industry, so that way they're better able to pick out what it is that human trafficking looks like and how best to respond to a victim when something's identified.
This seems like an easy one. I mean, it's getting through pretty fast. How quick do you think this could become a law?
Again, we would want to see this implemented as soon as possible, because this is not something that might happen in the Commonwealth. I have Interstate 80 cut right through my legislative district, and whether we're looking at the human trafficking that's taking place at our ports in New York or Philadelphia, and then transcending deeper into the heartland of the United States, it's imperative that we get this done as soon as possible, sooner rather than later.
Is there an element to this that once you're better at recognizing it, what to do next?
Yeah, so again, in collaboration with law enforcement, this bill was crafted working with PSP, working with trade organizations like the Pennsylvania Restaurant and Lodging Association. So really bringing all of the stakeholders together so that way we can offer a closed loop solution and again, equip these employees within these specific industries as much as possible so that way they can be allies in us as we push back against this atrocity and evil within the United States.
All right, well, in the spirit of togetherness and getting things done, I think you have found two really important things that are going to get through. So congratulations on that. Great to have you on the show here. Happy holidays, man.
Joel, Merry Christmas. Thanks for having me.
Yep, right back at you. So folks, we're talking about ways to help, right? How about another lawmaker who wants to protect children better? He's got a plan to keep vaccines accessible, keep them affordable, but it's not a mandate. We're going to discuss that, plus how AI is getting into the healthcare field as well. Stick around. Welcome back. Our next guest is a representative from Allegheny County, District 30 to be exact. He is a doctor and he's behind some bills about vaccine access, artificial intelligence in healthcare, a lot of good stuff to talk about. Welcome back to the show, Arvind Venkit.
Thanks for having me.
Good to see you. All right, doctor. First of all, how unique is it to have a doctor actually in the legislature?
I'm the first one since the mid-1960s, so it's a great privilege to represent my community and to continue to practice as an ER doc.
What made you want to get into politics then?
I was the president of the State Emergency Physicians Organization when COVID hit, and the divisions in our community related to science and healthcare really motivated me to feel that I should get into the political process.
Yeah, has it turned out the way you thought?
I think in general, yes. You know, it's been wonderful to work with my colleagues in the legislature and have been able to get some good policies across the finish line and into the public forum. So on behalf of my community, I think it's great.
But you didn't give up the other job either?
I did not. I still practice as an ER doc. I wouldn't want to give up seeing patients.
Yeah. Where we are right now then, you have these bills that you want to get across. Let's talk about the first one. It's this vaccine access bill. Tell me about it.
Yeah, so we're going to be voting this week on vaccine protection in Pennsylvania. We've passed one bill, House Bill 1828, to protect insurance coverage. This second bill is to make sure that vaccines can continue to be accessed through pharmacies by Pennsylvanians, which frankly has been threatened by actions at the federal level.
Explain that a little bit more. What's the problem you're trying to solve?
We saw in the fall the inability to obtain vaccines at pharmacies that Pennsylvanians have come to expect. Through executive action, we've been able to temporize on that. We need legislation to confirm that.
So would this instead kick it back to Pennsylvania? Like if Pennsylvania Department of Health believes that this is important and this is a vaccine, you guys could say, or they could say that, and then the insurers would have to comply versus the federal level saying that?
Correct. So we want to make sure that we have evidence-based public health policies here in Pennsylvania, and we can ground that in our Department of Health, which is accountable to us in state government and to the public.
Have you seen that politicized on the state level as much as it has on the federal level?
I think, unfortunately, yes, but I think there is a recognition that vaccines work, they save lives. We're seeing a huge measles outbreak right now in South Carolina. We can't be held hostage in Pennsylvania to these policies at the federal level.
Is there any vaccine in particular that you think has been affected that you want to make sure that access is there?
I think all of them that are FDA approved have been shown to be beneficial. I think the ones that are critical right now are flu and COVID vaccines, as well as the measles vaccine.
So people not able to get those right now?
So right now we do have some temporary truce, so to speak, on coverage, but in terms of insurance coverage, that will lapse in 2026 unless the insurance companies, out of their goodness of their heart, decide to continue cover vaccines. And pharmacy access, we have challenges related to pharmacy access if we don't pass legislation.
Are these expensive for folks if they are not covered by insurance?
It's expected that childhood vaccines, if there was not the mandate to cover these without patient responsibility, it could be either up to $1,000 or even more for a family to vaccinate their child.
Flu shots more, like $15, $20, $25?
So they're less expensive because they're only obtained seasonally. They're not a whole schedule, but we have this situation where if we don't have widespread vaccination, we're going to have problems with these diseases that we thought were in our past.
And once again, some people want choices when it comes to this. Like, don't make me have a vaccine. We know that was some of the hesitancy before. We're not talking about that. We're just talking about if you want to be able to have it and not have expense be a part of it.
Correct. This is not about a vaccine mandate. This is for those Pennsylvanians who choose to receive vaccines, that they still should be able to access them and that their insurance will cover them.
Got it. All right. Now my favorite / least favorite topic, artificial intelligence. I've dealt with this on so many kind of things. I could take a picture of us right now, manipulate it, and have us giving each other vaccinations or who knows what, because it's just so wild. When it comes to healthcare, what are you seeing?
So it's affecting my practice for the benefit. The biggest application in the emergency department is we use AI in order to do our clinical documentation. That allows me to focus on the patient as opposed to a computer when I'm seeing a patient. And so that's a great thing.
How so? Explain that.
So there are AI platforms that you ask a patient's permission, you record your encounter. It can also bring in information from the medical record, and so it can create the documentation that you need for a visit, and I can concentrate on you.
Got it. So those are the things that I think most people would agree is a nice use of AI.
It's a good thing.
You didn't take away someone's job.
Right.
You didn't manipulate a picture to make me look foolish. It just made you better at your job.
Exactly.
Okay. Is that being threatened? Like, what's the problem with that?
So that is not a threat. The threat with artificial intelligence is that, first of all, it's not transparent to the patient and the public when AI is being used right now in healthcare.
Okay.
The second is the best information we have is that AI needs to be combined with expertise from a physician or from a health professional to get the best outcome. And we need to make sure that that human decision maker is still there. And then lastly, because we don't know where AI is being used, we don't know if its use is potentially violating our existing laws on privacy, safety, and anti-discrimination.
Okay, so let's say you want to do this and you get some support. By the way, does it have support so far?
It has bipartisan co-sponsors, and so my hope is that we'll be able to move forward in the new year.
All right, and everything's like great. And then all of a sudden you hear from the executive level, executive order from the president, we don't want states to make artificial intelligence laws. Is that affected by something like this when you're trying to do a state law and then yet up there they're saying don't do these things?
Frankly, I think the president's executive order is blatantly unconstitutional, and members of his own party have said that. Members of Congress have said we believe that states should still be able to do this. You need a federal law to supersede state action. And even our Attorney General said that he believes that we need to defend the ability of states to do this, as has the governor. So I'm confident that we can take action here in Pennsylvania on behalf of Pennsylvanians.
Big picture view, though, do you understand, the argument of you shouldn't have 50 different laws in 50 different states when it's one company trying to do something, maybe even a positive AI company trying to do something, but now they can't do it because of this patchwork of different laws out there.
I think states are the laboratories of democracy, and we're already seeing AI implemented in legislation in a variety of states. So I think that horse is out of the barn. I think that we need to protect Pennsylvanians, and especially in the area of healthcare, and I'm proud to champion that with bipartisan colleagues.
Yeah. But you've also seen the downside of AI and how nasty that can be for mental health and for kids and for things like that. So maybe some federal laws would be good when it comes to those kind of things that we all agree on.
I honestly believe that we need both federal and state action.
Yeah.
I think, unfortunately, at the federal level, the president and those in power in Congress have not shown the ability to take action on this or a number of other areas. And so we have to step up at the state level.
I hear you. All right, well, happy holidays. We're here. The holiday week is getting going, and thanks for spending some time with us, Doctor. I hope not to see you there, but I like to see you here.
Absolutely. Happy holidays. Great to see you.
Very good. All right, folks, we're coming right back. We're not done yet. Favorite time of the week, everybody. Welcome back to the CBS 21 Political Insiders. Democratic strategist Tony Lepore is here, Republican strategist Charlie Giroux. Let's get to it. So earlier this week, it was Senator Kristen Phillips-Hill, a forthcoming legislation saying a lien should be placed on private property that's received upgrades using state funds. The lien would be to the amount of the public funds used, would be triggered or paid upon the subsequent sale or transfer of the property. Of course, this is about the stuff going on at his private residence in Montgomery County. What do you think of this idea?
So I think we do need to keep an eye on what's going on at his house. I'm not sure we need this law just yet. I think let's keep an eye on what's going on, what has transpired. I'm not sure we need one more law out there.
What do you think?
We clearly need to keep an eye on what's going on because there's way, way more than should be going on. The problem I have with this particular bill is how do you put a lien on pruning trees? You know, I mean,
you can't get that back, right?
You can't get that back. And this is the problem. The governor's spending all this money on his own personal residence, which isn't even worth the entire cost of the project.
Yeah, $1.1 million on the upgrade, $750,000 for the cost of the house at that point. Is this political only, or is this a real thing?
I think it's political.
Okay, agreed?
It's real.
Okay.
Even Tony says we got to keep an eye
It could
on
be other
this guy.
properties as well in the future. We'll see. President Donald Trump, via another executive order, has reclassified marijuana so it can be used in research more. The reclassification takes it away from other drugs like heroin or ecstasy, changes into something with low potential for addiction. Well, first of all, your idea on this, do you think it was the right move?
I do.
Okay.
And, you know, I'm not with a lot of my conservative brethren on this one. Haven't been for a long time. I think it's ridiculous to have marijuana classified with heroin and LSD and other really serious drugs.
I know you also thought it should be, changed here into a recreational use drug. Would this make this more likely to finally pass that hurdle?
I do. And as you know, many, many states have passed recreational bills. We're lagging behind, and as a result, not getting the tax
All
revenue.
the states around us, for sure. Does this change anything?
Yeah, I agree with Charlie. Here's what it changes mostly. It's going to help the tax piece of it, and it's going to help the banking part of it, and that's the most important. And in time, I think it will help adult use get to the finish line, but it's going to be a little while yet.
Let's talk Republican defections. 4 Republicans voted to try to extend the health care subsidies and get that going with the Affordable Care Act before they balloon up. 3 of the 4 from Pennsylvania. What's going on here?
Well, they're in very marginal seats, and that's the be-all to end-all of this one. They're in tough seats.
But there's no other seats that are tough around the country where 3 of them are from our state?
Well, there are other tough ones, but there are probably not too many that are as tough as those 3.
Do they get a pass on this from the Republican Party, knowing that they're in that situation and they don't hold it against them like we're going to primary you now?
No, they're not going to get primaried. If they were primaried, they'd lose. So not they would lose, the primary
The
challenger
seat would lose.
Yeah.
What do you think? Were you surprised when you saw that?
No, I'm not surprised. They want to keep their jobs. They're in tough seats. These are some of the toughest seats in the entire country. Pennsylvania is sort of ground zero this coming year, and it usually is, but it really is.
It really is this time. Hey, some estimates are, millions will be, kicked off of their health insurance because they don't have these subsidies. What's the Republican plan on this moving forward?
Well, the Republicans have to come up with a plan. I think that's the one deficiency of the Republican caucus right now, is that they haven't clearly articulated and enunciated a plan to deal with health care. It's time to do that.
Shouldn't they just compromise here and say, instead of 400%, let's make it 200% and keep working on it?
Well, I mean, look, the ACA still has magnitudinous problems. Did from the beginning, still does now. I think a complete restructuring would be the best way to go, but we'll see.
That would take a long time.
It would.
But there's no plan, and there's never been a plan. And Trump has talked about a plan. There's no plan. But what's going to happen is our neighbors are going to be kicked off. They're going to pay 100% more than what they're paying now, and we can't afford it. That's the problem.
We're all paying way more than what we were promised. Obama said costs are going to come down. You tell me the neighbor that you have, Tony, whose costs have come down.
I'm actually happy with my costs right now.
Good for you.
It's going to be worse, though,
You can pay some of mine
in 2
then.
weeks.
Well, if anyone knows about the healthcare system right now, it is this guy right here.
That's a valid point
That's a
right
talk
there.
for a different time because we know how important that can be. Let's talk about inflation. So this is some positive news for the Trump administration. Unexpectedly slowed to 2.7% in November of 2025, lowest it's been in months. They're saying moderating housing, food, apparel costs. Although economists are saying, well, hold on, some of this was distorted data. We didn't have it all. We had no one working on this because of the shutdown. What are you taking out of these numbers?
It's a fraction of the data. They are getting like 60 or 70% of the data. So it's inaccurate. Junk in, junk out. They didn't have the good information, so they're kicking out bad information.
Well, 2.7 still sounds pretty good, though.
Inflation is on its way down. Look, the bottom line is very clear. The Trump administration inherited a complete mess from Joe Biden and company. They had screwed up the economy in every way possible. It's coming back. Larry Kudlow, one of the most respected economists in this country, says that 2026 is going to be a gigantic plus for the economy.
If they're going to take credit for it in 2026, is that when they finally stop blaming Biden for it? Like when do the Republicans take charge of this economy and say, this is now ours?
Well, there's that famous story about the 3 envelopes, Blame the other guy, blame the other guy. The third one is, write another envelope.
All right. And with that, we will close down this segment. When we come back, we are going to look at the new Donald Trump Kennedy Center. Really? Because I got some visual evidence, and I have a new idea to name something else, since we're just naming things now. Have you seen this yet? Let's get right to the video. The renaming of the Kennedy Center to the Donald Trump John F. Kennedy Memorial Performing Arts Center. The name is being put on it on Friday. Your thoughts as you look at those letters right there?
I think it's a crime, literally, to take the name of one of the greatest presidents, John F. Kennedy, and put your name in front of it. It's a crime.
He says the board approved this.
He's the chairman of the board. You know what I mean?
Picked a few members of the board, I guess.
We only do this. You do this in North Korea.
You don't like it. What do you like?
Well, as you know, as a Republican, I'm a John F. Kennedy fan, tax cutting, anti-communist. Yeah. But I mean, there are some serious problems with this. First of all, there's a question of the legality.
I know it's going to be tough. I got to cut you off.
Most important,
hurry.
You don't name buildings, et cetera, after living people.
Well, that would be a problem then, because look what I've done. Look at this video right here. Bring it up. I've renamed the Supreme Court the Jerome Laporte Center.
Well, we're for that.
Yeah,
I can live with that.
The Center for Decorum. There it is, guys.
I can live with that. I can live with that.
That's the best we've come up with.
Yes.